Good day. I am Latham Williams, your host on the Illinois Law Show, and today's topic is healthcare reform. And we are fortunate today to have two experts in the area. On my far left is Dr. Monique A. Anawis. She's a MD and a JD. She's an eye surgeon and an attorney engaged in the practice of medicine and also in academic medicine. She's a dedicated board certified surgeon with experience practicing medicine and training physicians in the US, Europe, and developing countries. She also is a John Marshall Law School professor of health law with subject matter expertise in healthcare policy, regulatory matters, and legislation. And she's the current vice chair and incoming chair of the Healthcare Section Council of the Illinois State Bar Association. Also with us is Carolyn Metnick, and she's an associate with the prestigious Chicago office of Barnes and Thornburg and a member of the firm's healthcare department. Ms. Mesnick's practice concentrates on transactional and business issues affecting healthcare providers. She counsels clients in joint ventures and stock and asset transactions, including mergers, acquisitions, and other reorganization. She also advises clients in dispute resolutions and represents healthcare providers in business litigation, including breach of contract matters and enforcement of restricted covenants. So you can see we have quite a august panel today to talk about the very interesting topic of healthcare reform. So I'm actually going to start with Ms. Mesnick and ask her sort of the basic question. What is healthcare reform?
Well, that's a very basic question, but an interesting one, Latham. Thank you. Prior to March 2010, healthcare reform was really a general term used to describe major healthcare changes and an overhaul to the healthcare system that never happened. As of March 2010, with the enactment of PPACA, or the Affordable Care Act, and the Reconciliation Act, which followed a week thereafter, healthcare reform has come to mean the enactment of that legislation and the implementation of those laws, which provide very comprehensive changes to the insurance system and just healthcare law. And most of these changes are going to roll out over the next 4 years. Some of them we've already started to see, but most of them are going to be implemented by 2014.
Now, we hear a lot about the Healthcare Reform Act, and one of the questions that's on the minds of many is whether this healthcare reform will in fact lower the cost to Americans. What's your view about that?
I think it will. It's supposed to, and there are a couple ways that that's going to happen. One is the act provides for a tax credit for small businesses. A small business is essentially defined as a business with 25 or less full-time employees. This also includes tax-exempt organizations, and the businesses will be provided with an incentive to offer healthcare insurance to their workers. Another example of how this is going to save money is the prohibition, the elimination of annual and lifetime caps on coverage. So prior to 2010, what one would often experience is, and one would see this on their EOB, their explanation of benefits that they receive from their health insurer. They would see a annual cap and how much of that they've eaten into, and perhaps a lifetime cap and how much of that they've eaten into. And for an annual cap, if a beneficiary met that amount or exceeded it, then the amount after that would come out of their own pockets. So this is a great thing because it's going to keep more money in the consumer's pocket. So the lifetime cap was eliminated, I believe, last year, and the annual cap is going to be phased out over the next 4 years, such that more money will be kept in the consumer's pocket. A little bit more money will be kept in each year through 2014.
Now, there are so many interest groups when we talk about healthcare reform, and one of them is just the patients as a community themselves. Dr. Anawis, what do you think are the current concerns of the patient community? And we'll talk about some of the other communities too.
There are many concerns. I think two of the key concerns are cost. Patients are seeing that their premiums each month may be rising, their cost of their medications may be rising. And beyond cost, I think patients want the choice of their physician. They want to be able to say under the insurance, can I choose my doctor and is this an affordable plan? And as Ms. Metnick said, there are increases to affordability we can anticipate with health reform, and one is the elimination of gender rating. And by gender rating, that means that if a man and woman of the same age with similar medical conditions were to seek insurance, typically the woman would pay much more for the same insurance coverage as a man, and under health reform, that would be eliminated. So that's another affordability which will help patients' concerns for costs.
And that was something I just read about recently. I didn't even know about, and I couldn't believe it. I don't know why that was in place.
Yeah, what do you think, what are your patients asking you specifically? Are they asking questions of from wearing your physician's cap? Are your patients coming up to you saying they're worried about healthcare reform, or are they just coming to the office, getting treatment, and putting that question behind them?
That's a great question. I think there is a great deal of concern, and as a physician and as an attorney, part of what one tries to do is to encourage patients to educate themselves, and in our way, to educate patients and to find out more of the many benefits that they could have. There'll be many benefits for preventive health care signed into the bill patients can take advantage of. Many that include the high cost, we can all agree, of medications, particularly for the elderly who are on fixed incomes. Many come, and if you don't take the time to articulate, are you affording your medications? Should we think about maybe making changes? Then you don't know, because patients typically elderly are on a fixed income. And when you've got your rent, your utilities, and then you have high medications, you don't want patients to be in a position where they need to make choices of either not paying for the medications because they can't afford it, or choosing what they feel is the most serious condition to cover by paying for that medication and not the others.
Well, that's an interesting topic, the elderly. And Ms. Mesnick, do you have a view about what you also think the impact of healthcare reform will have on our elderly community?
I think it will. I certainly hope it'll have a positive impact, and the legislation suggests that it will. And one primary example that I can think of is the closing of this gap, which attorneys and other experts in healthcare law and healthcare refer to as the donut hole. But it's really a gap in Medicare Part D prescription coverage. Medicare Part D is a prescription benefit that one can choose to take part in if you're eligible for Medicare. And it provides, Medicare Part D provides for a deductible that changes every year. It's around $300. Once that deductible is met by the beneficiary, then the beneficiary pays, I think it's 25% for the cost of any prescription drug. And the rest is covered by Medicare, the remaining 75%. However, once you reach an amount that's close to $3,000, it's under that, then the gap begins. And this gap in coverage means that the beneficiary is responsible for 100% of the costs, and the gap is about $4,000. And then once you get to the end of the gap, then Medicare starts picking up the bill again for 75% of the costs. But unfortunately, an elderly person or someone who's participating in Medicare Part D is going to experience a very significant gap and go out of pocket for about $4,000 in costs. Now, with the passage of the Affordable Care Act and the Reconciliation Act, this gap is going to slowly close. So one of the things that consumers and Medicare Part D beneficiaries may be seeing is, specifically last year, the government cut checks in the amount of $250, and they were tax-free, and they were sent to individuals who were in the donut hole. Now, this year in 2011 and on a going forward basis, they're seeking to close that goal by requiring that manufacturers who make these drugs sell them at a significant discount. So beneficiaries will be able to buy them at a 50% discount when they're in the donut hole. That's going to save them some money.
If the elderly don't have the two of you to go to, and you're full of information about the healthcare reform, do you have any just general recommendations of where, not just the elderly, but people who want to know more about the health reform can get that information?
There's several sites. Healthcare.gov, the government website, is very informative. Also, the senior facilities and the Department of Aging, where everyone lives, is extremely helpful. If, for example, people don't have the resources of going to a computer, but the healthcare.gov website, the Health and Human Services website, and the Medicare websites. Also, part of the initiative of health reform is an evaluation of quality of physicians and other healthcare workers and facilities. And that information is already starting online on the government websites, so that one will be able to go with increasing amounts of information on these websites and see where, for example, you can choose more informatively your physician, other healthcare worker, and facility over time.
That's very helpful information. Now let's switch to the other end of the continuum. We'll go back to you, Ms. Mesnick, and that is, how will healthcare reform impact young adults?
That's a great question, and I think it's a very exciting change. It's going to impact them in a positive way. So, for example, prior to the enactment of the Act in last year, young adults were only allowed to stay on their parents' insurance plan until the age of 19, unless they were full-time students or other various exceptions and limited exceptions. That was the general rule. Now, with the enactment of the law, young adults are able to stay on their parents' plan until the age of 26, and that applies regardless of whether they're married, whether they live with the parents. The only exception generally is if they have the opportunity to acquire and obtain healthcare insurance through their job. And again, this is a general rule because there are some grandfathered exceptions. There are plans that are called grandfathered plans. So it would be important for a consumer to check into that and see whether they in fact have a grandfathered plan. But the general rule is that the plans are going to allow for a 26-year-old child of a parent to stay on the plan.
And we really haven't talked about the phasing in of the various sections, but my understanding that this one for the young adults up to 26, this rule is already in effect. Is that correct?
It is already in place.
And it isn't already in place, but for the grandfathered plans, they, I think, will have to comply by 2014. I don't think that exception's permanent.
And additional sort of benefits at the younger end of the spectrum begin in the essential benefits that are accruing under health reform, meaning that now the delivery of children and newborn care will be required as a minimal covered benefit under insurance. And already in place and will be in future are elimination of pre-existing conditions for the case of children, and a temporary pool for people with pre-existing conditions. By that I mean that if patients have certain diagnoses, insurers would not allow them to obtain that insurance. Example for some is a seizure disorder, and if you had this condition you would not be able to get insurance. But for the time being and for children at this point, now people can be insured who were uninsurable previously.
Well, we are about to go to break. And some of the questions I'd like to ask are more about what do physicians think about this, and what do we expect to see in terms of some of the major other changes to the healthcare reform bill. I know that some major date of 2014 seems to be huge. So we'll come back after the break and talk about that.
Bye-bye, Tyler.
Dear, it's time for serious talk.
Oh?
About my daycare. When I started out, it was just to help the neighbors. But lately, it's getting to be a real handful. I need some help.
What can I do?
I need advice on more space, a loan,
What about incorporating?
and insurance.
Wait, I know who we can call.
Times like this require sound advice. Your lawyer can help. A message from the Illinois State Bar Association. Over and over. Time and again.
Drive me nuts. Shut up. You're the dumbest.
Generation after generation.
I hate you. I hate you too.
Isn't it time we stop the cycle? Now. Stop adult violence. Teach kids peace. A message from the Illinois State Bar Association.
Well, welcome back. I want to, if any of you are joining us today, I just want to remind you I am Latham Williams. I'm your host. To my far left is Dr. Monique Anowitz, who's an MD JD, and she is a well-known eye surgeon and attorney in the greater Chicago area. And she's a dedicated board-certified surgeon with experience in practicing medicine and training physicians throughout the U.S. and Europe and developing countries. She's also a vice chair and incoming chair of the Healthcare Section Council of the Illinois State Bar Association. And again, as a reminder, we have Ms. Carolyn Mesnick, who is an associate in the Chicago office of Barnes and Thornburg, and she's a member of its fine healthcare department, and her practice concentrates on transactional and business issues, and she also counsels in dispute resolution and represents healthcare clients in a variety of substantive areas. So we are talking today about healthcare reform. And I'd like to continue the discussion. We've talked about a variety of categories of persons who are impacted by the healthcare reform. And so, Ms. Mesnick, I'll come to you and continuing a new category, and that is, how does the healthcare reform provide coverage to children? This is way beyond just up to the 26-year-old coverage aspect. Any thoughts on that?
Well, the Act, or the Affordable Care Act, provides a lot of great benefits for children. Number one, children with pre-existing conditions cannot be prohibited or denied coverage, and I'll let Dr. Anowitz speak a little bit more about that because she knows more about what is a pre-existing condition. That's number one. Number two, all these great preventative screenings are now going to be without cost to the parent. So a new baby will get its well baby visits. A child will receive all his or her annual wellness exams up to the age of 21 without the parent having to pay a copay or reach a deductible. So there will be no out-of-pocket costs to the parent for the care of that child.
Well, what is a pre-existing condition?
A pre-existing condition is a diagnosis or medical condition that if one has it and the insurance company chooses to use that diagnosis as a pre-existing condition, they will not choose to insure you under their plan. It can be a problem, and in the case of children, the healthcare reform is protective in the sense that they've eliminated that being an exclusion for children to get insurance. In adults, it can be a problem, for example, if you get your insurance through your employer and your employer the following year decides to change insurance companies and you were insurable. If you have that certain diagnosis that the new insurer considers a pre-existing condition, you may not be insurable under the change of plan from your insurer. Now we're under health reform, there will be temporary pools for people with these diagnoses so they can, at least for a period of time, be insurable.
And when does that provision go into effect?
That is in effect currently. When that time will escape, when patients with pre-existing conditions can be insured, has not yet been made clear.
But these, just to add upon that, this plan that's been created, and we're talking about adults now because we know that children with pre-existing conditions cannot be excluded. But adults, the law is going, the health insurers are, the insurance policies are going to change by 2014. They're no longer going to be allowed to discriminate against pre-existing conditions. But we have this period from 2011 now through 2014, and what the government's doing and what the Act's provided for are these pre-existing condition plans, which an adult with a pre-existing condition can apply for, and you have to meet certain eligibility requirements. You have to have a pre-existing condition that's been diagnosed, and you have to have been denied insurance, and you have to have been, I think, without insurance for 6 months prior to applying for this plan. And you have to be a U.S. citizen or a legal resident. There are other, I think, minimal requirements. So this plan is something that an adult with a pre-existing condition can apply for and get coverage. And it would not only cover them for their pre-existing condition, it would cover them for other, wellness exams or other things they need. So that's kind of an option to kind of fill the time between now and 2014. But eventually, we're all going to get coverage. That's the hope.
So, Dr. Anowitz, what are the physicians? Let's put on your physician cap. There are a lot of caps you wear, but let's put your physician cap on. What are your colleagues thinking about or concerned or worried about under healthcare reform?
I think there's any number of concerns, but the overarching concern is, will I be able to take care of my patients in the best manner that I can? Will the resources be there for me? Will my patients continue to have a choice? There's an estimated 47 million either uninsured completely or what we call underinsured. And by underinsured, we mean people that have some insurance, but it is not comprehensive. For example, if you need hospitalization, that is covered, but to see your doctor would not be. So I think we're concerned, and I'm concerned about the many patients who are unemployed that previously had their insurance through their insurer, and they've lost their jobs, or they've become part-time employees and lost a benefit, including their health coverage. One possible way of addressing that health reform in a sense may anticipate is a move toward community health centers. And part of that vision is to use certain geographic areas in which you would provide a locus for health care, and largely that would be really powered by physicians, nurses, and other healthcare workers who are in primary care, meaning internists, pediatricians for children, and family medicine. And then you would reach out to specialists as you would need them. And that may be a way of helping people for the time being who are uninsured. But it is one option. And health reform gives us many new options. And ideally is an elastic document that allows us to see what changes come in the future.
Well, we are, believe it or not, running to the end of our segment. But before we leave, I'd like to get each of you to give me one or two things you'd want our viewing audience to take away on the whole topic of healthcare reform. And let's start with you, Ms. Mesnick.
I think healthcare reform is a good thing. I think we should embrace it. And I think it provides opportunities for consumers and patients to get more involved in their own health care. There are a number of resources out there that are required by the Act. For example, this website, and I think it's in particular, it's the healthcare.gov, which is a great website, by the way. And Monique, Dr. Anowitz referred to it earlier. I have been on there myself to confirm various facts, and it's very, very user-friendly.
And let me get 30 seconds or less. What's your takeaway?
I look at it as an opportunity with added benefits for patients, and particularly wellness and preventative care, and encourage patients to find out the benefits they will have and engage their physicians and other healthcare providers to see how they can better improve their health. It's more than just reducing, hopefully, your costs of medical care, but to educate yourself to take care of yourself as well.
Well, thank you. I thank you both for being our guests today.
Thank you.
And I think our viewers have benefited tremendously from the great knowledge that you have and the resources that you are providing them to secure additional information about the subject. This is a very complicated topic, so thanks for helping clarify some of this for us.
Thank you.
Thank you.
All right, it's been great.
Thank you.